দাদাকে একটু বলে দাও না।
খাওয়াতে পারলাম আমার ওই সেলাইনের জলটা পুরো দিয়ে দিলাম, দিয়ে ওইটা ফুটো করে ওঠে তো দিতে করে খাই।
I don't know. I think they are in the college was conducting every day morning. Before starting, they'll put all this. We have all, I think. They all group it to say. The best thing is that nobody.
ওষুধটা খাইয়ে দিতে পারলে দেখবে একদম ঠিক হয়ে যাবে। হ্যাঁ, তুমি আমাকে ডাকবে। আমার এটা যদি ওরা শুনতে পারবে না কথা বললে।
तो बराबर जो जाएगा उनसे बात करनी पड़ेगी ना।
दोस्तों 300 से भी ज्यादा कंपनीज को मैं ट्रेनिंग दे चुका हूं और आज 2024 में जहां जाओ वहां एचआर
hundreds of leads to respond.
Done.
नहीं बनेगा टेबल
Bhavna madam, we can start.
Okay, ma'am. Hello, am I audible?
Yes, madam.
Yes.
Good afternoon, everyone. Jai Swaminarayan and welcome back to second day of National Webinar on Forensic Nursing. I welcome speakers of today's session, all the dignitaries and participants from various parts of the country. I hope you all had fantastic time in yesterday's session and are excited as I am for what's in store today. We have another lineup of incredible speakers and engaging topic that promise to deliver valuable intuition and incredible takeaways. Now let's start with our first session of the day. I'm thrilled to introduce our speaker, Dr. Jyoti Katwal ma'am, Assistant Professor, College of Nursing, AIIMS Bilaspur, Himachal Pradesh. Ma'am has completed PhD Nursing and having more than 23 years of experience. Ma'am has organized, attended, and is a speaker at various international, national, and state level conferences, webinars, seminars, and e-learning programs. Ma'am has published various articles in journal and authored in 3 books. She is a trainer for simulation-based education, COVID-19, mental health, and Omicron. Ma'am got award for best service during COVID time and active researcher and best paper awarding. She will conduct the session on emergency trauma nursing. Over to you, ma'am.
Good afternoon to everyone, and thank you so much, Bhavna, for giving the introduction, and good afternoon to the organizer and beloved friend, Dr. Alka. Thank you so much for inviting me and giving me an opportunity to interact with you all. I'll be talking about forensic nursing. Am I allowed to share my screen?
Yes, ma'am.
Yes, I'm allowed. So my screen is visible, I hope.
Yes, ma'am.
Yeah. So first of all, greetings from AIIMS Bilaspur, though right now I am not in Bilaspur, but weather is similar like Bilaspur. It's about to rain today, and I hope there is a pleasant weather in Gujarat as well. So before I start with my presentation or the topic that we are going to talk about, I would like to ask the audience what kind of emergency department you have seen and what kind of patients you have seen that we receive in emergency department. You must have seen in the big hospital, it is always written emergency 24/7. So what kind of patients do we receive in emergency department? You can just send your answers in chat box so that we can see. RTA, very good. Road traffic accidents, then It can be any emergency. It can be assault, very good. Like Dr. Binu was talking about yesterday. Sexual assaults, violence, poisoning, very good. Suicidal cases, any kind of trauma, any kind of life-threatening situations that would come into our emergency department. So it is not necessary that it would only come in the evening or in the post-working hours. It can come anytime, even in the during day also. So whenever we are expecting that we have some trauma or any kind of abuse, any kind of violence, or any life-threatening situation, those patients would come to emergency departments. So it is a very critical situation that we are dealing in emergency department. Is my screen moving?
Yes, ma'am.
Yes, ma'am.
So now what we are going to talk about basically is how forensic nurse is collaborating with emergency or a trauma nurse. So forensic nursing, just an overview, what was done by yesterday is very well done. Even in the public health side also, it was discussed beautifully. So I will be majorly focusing on the emergency nursing. So emergency nursing, as I mentioned, is dealing with the patients who have got life-threatening situation, and we want their situation not to degrade, and we want them to be stabilized. So any problem which is coming in the emergency situation, we are dealing with it and we are stabilizing the patient as well. So talking about the emergency nursing principles, first we perform is primary survey and secondary survey. When I'm talking about the primary survey, we are looking only for the critical organs like airway, breathing and circulation. So once we are thorough, once we are sure कि हाँ ये ABC is done, ABC is perfectly working, there is no critical condition related to it, then we perform secondary survey, then we go into details, what is the major problem or what are other problems that patient is having. So in that case, we will maintain a patent airway, we will provide oxygen, we will provide, if required, artificial ventilation also, we will control the bleeding so that patient does not get any kind of shock. We'll also look for the restoration of circulation. We'll go for administration of fluids. We will assess the neurological functions if there is any head injury, or looking for the cardiac functioning through the cardiac monitoring, and also look for the management of wounds if there are any, as one of you said that road traffic accidents would be there. So we have learned what is emergency nursing. We have learned what kind of patients that we require. So do you think that emergency nurses need to work quickly and very efficiently? Do you agree with me? How quickly they are supposed to work? They are supposed to work very quickly, and they need to work very efficiently. And in that case, what are we supposed to do? We are supposed to assess whether patient can be we have to, in that critical situation, that you must have an idea of emergency where everyone is running around, every patient is important, and we are trying to save every patient. So in that hurry, we are supposed to take a consent. We are handling the evidences. We are handling with the reporting. We are supposed to report to the any police person or any legal authority, so that we are able to identify any kind of abuse. And we have to work very in an expert manner so that patient's background or religious beliefs are not hurt. And we have to be calm. We cannot shout. We cannot create any kind of chaos in that situation. Now, what kind of roles that emergency nurses need to play? First thing is very big one is assessment, because in assessment only I will find out whether patient is to be sent to a OT, whether patient is supposed to send for the investigation. So triaging is important before my assessment. So my assessment will be basically taking a health history, especially related to what has happened. If it is a road traffic accident, how it happened, what kind of injury patient is reporting, what kind of pain patient is reporting, and plus patient is already taking any medications or no. And quickly I will go for a physical examination. I will not go for a detailed examination. I will only go for a quick examination, because I am looking for life-threatening condition which need to be addressed immediately. But in this case, I should not forget that I have to look for different evidences also. Might be somebody has hit the person purposely. if a gunshot injury has come, so patient says, "नहीं, accidentally मुझसे gun चल गया था, इसके लिए मुझे shot injury." But you cannot believe that. You have to work very efficiently, and then the forensic nurse would be called. And also, it is not that once you are done with the assessment, you're not going to assess the patient. You are going to assess the patient periodically. So in that case, you will be assessing whether patient is going into deterioration, whether patient is improving. All that assessment will be done when you are reassessing the patient periodically. And you have to plan and manage the care, because as I said, you have to decide whether patient will go to OT, whether patient will go for investigation, whether I can delegate the patient to a some other nurse or a junior nurse, how many visitors are supposed to be there. So all that planning and managing has to be done very quickly and very short period of time. And different tasks will be done, as I mentioned, taking the samples, putting the NG, putting the catheter, administering the medication, doing the wound, dressing wound. So all that will be done in a very swift and quick manner. But you will also be able to give some treatment if you have a standing orders. It depends on hospital to hospital. When, as I said, in assessment, I will be doing the triaging. And when I'm triaging, I will take care that various forms of violence is there. It is not necessary that it will only be female patient. It can be a child. It can be an elderly. So those patients will have signs of abuse or trauma, but they will not be explicitly available. कि सामने ही दिख रहा होगा थप्पड़ मारने का निशान. No, not like that. They will be, hidden. So you have to be very careful when you're triaging the patient. So victims of such violence require a trained healthcare professional. So here comes the role of a forensic nurse. And forensic nurse will come with the assessment of intentional or an unintentional injury that will be done by a forensic nurse. So as a medical nurse or as an emergency nurse, I will be contacting the patient as a first contact. So he or she will be giving me some history, but I might miss something which is related to medical legal examination. So forensic nurse will address that area. So forensic nurse is an indispensable core of advanced patient care. And what do forensic nurse will do? She is specialized person who takes care of victims and violence as well as for the abuse. And they are trained for doing the medical legal examination, collection of evidences. All that is done by a forensic nurse. So when a forensic nurse is collaborating with the emergency nurse, they have different specialized role, like correctional nursing or custody nursing. Let's say a prisoner has come and that custody will be only done by a forensic nurse. Sexual assault nurse, say for a sexual assault forensic nurse. When I'm talking about sexual assault examiner, she is only supposed to examine the patient. When I'm talking about the forensic examination, see, she is supposed to look for the DNA. She's supposed to look for the fingerprints. She's supposed to look for different yeah, it's there, I guess. Yeah. So thank you, Alka ma'am. So forensic examiner, what she will do is she will be looking for the forensic evidences, collection of evidences. So when I'm talking about the response team, it is a collective people. It is not a single forensic nurse. It will have different people in it, not only a nurse, but medical practitioner also, and helping other team members. And referral centers also are there. So different variety of roles are there depending on the care required. So as a forensic nurse, when I'm dealing with a emergency case or an emergency nurse, I will be helping her to provide a holistic care and in a timely preservation of the evidence. This is the most important aspect. As I said, there might be some evidences, but as an emergency nurse, I might miss them out. So as a forensic nurse, she will be able to take a complete assessment of it and take a hold of physical, mental, and legal aspects. So legal aspect is the most important part, which might be missed out by trauma nurses. And beyond the regular patient care, we will be providing examination, which is medical legally focused, and documentation of that examination. I might see some violence traces. Let's say a woman has come after saying that she has got spontaneous abortion, but the symptoms or the bleeding or the physical examination does not coincide with that. It is revealing something else, that abortion has been tried or DNC has been tried. So in that case, documentation and examination will be focused by a forensic nurse. And it is not only examination or documentation, it is further submission of the different documentation, different evidences to the court. So you will have to go for the court visit also, and as a expert witness. So as a forensic nurse, what I have seen, what I have written, I will testify it, that this is what is done and this is what should be enlightened in the court case. And in certain countries, we have nurse death investigator also. So if in case a death has occurred and emergency nurse thinks that there is a something foul play in it, then I will contact the forensic nurse death investigator, and she will come and take a detailed examination and all the data collection related to that death. Now, as a forensic nurse, when I'm dealing with the emergency nursing, what all things am I supposed to do? I am supposed to go for an early recognition of any violence or suspicious situation. And I have to do the perfect documentation. It is not only between the nurses, it is the interdisciplinary approach also. I will be informing the medical practitioner. I will be informing that this is the my observation, and care has to be directed in that manner. And communication also involves services. If it is a sexual assault person, then I will contact the women health team also. I will also look for the legal help for the patient, and correct handling of the samples, and long-lasting quality assurance for the patient as well as the evidences. So as a forensic nurse, I am not a CID person. I am not a Daya, or I'm not a ACP. Okay, so what am I supposed to do as a forensic nurse? I'm only doing a clinical investigation. I am not looking for criminal. I am looking for the clinical evidences. I am not looking for the culprit. So what different technical skills I am supposed to have? I have to collect the evidences. Evidences like DNA, any fingerprints. It is not only the patient's body, it might be on the patient's clothes. So you have to look for the patient clothes also. Many times you must have seen in the movies that under the fingernails, they got some DNA or skin scraps. So all that will be collected by a forensic nurse. Apart from that, forensic nurse will also conduct specialized examination. Specialized examination with specialized tools like fingerprints are not that easily visible. They may require UV rays or UV lamp to visualize them. Blood stains which are being washed out, the protein remain on the skin surface. So in that case, UV lamp would be helpful. So such equipment handling and use and doing examination with such equipment is the responsibility of a forensic nurse. Documentation, as I've said, medical terminologies will be only utilized in a very organized manner and also in a very protocol based. I will not write any of the medical terminologies which I might have to remember it later and I forget. Let's say if I say PRN today is per rectal normal, so I might forget. PRN is SOS also. So it will be a difficult situation. So abbreviation should be as a standardized manner and should be used as minimal as possible. And forensic nurse need to have a photography technique utilization also, because one might have to take photographs on different angles, on different lights. So that is one of the skill required for a forensic nurse. And then packaging, labeling, and transport of the evidences. Evidences collected or samples collected are very important. And when I'm using them, when I'm giving the handover, that is also very important. I might give it to some healthcare professional or a policeman, which may temper them. So it is the responsibility of a forensic nurse that she has to take care that whomsoever I'm handing over that sample, it has to be a legalized person. In the case of forensic cases, it is protocol is made up that who is supposed to collect it. Apart from that, if you're giving it to someone else, then forensic nurse is liable. So packing, labeling, transportation is all a responsibility of a forensic nurse. And also as a forensic nurse, I am supposed to know about legal proficiencies. I have to have the legal knowledge about it. What are the different courtroom procedures? What is the use of evidences? How do I communicate in a court, and how do I convince the judge? I am not supposed to convince, but I am supposed to give the facts, what I have observed. And that also has to be done in a very unbiased manner and not conduct, not indicating towards anything. It is just an unbiased observation what I have done for my patient. And another important aspect is collaborating with the not only with the healthcare team, but also with the police person, with the law enforcement personnel, even the advocates. And for that, you require strong communication and teamwork. Now, these were the technical skills which are required. Generally, even the other nurses, even the trauma nurses and all nurses need to have empathy and compassion. So you have to have empathy, because we will have sensitive situations, we will have sensitive cases also, and very personal, or I would say sexually is very intimate kind of a thing that you may have to deal with. So you have to have empathy and compassion. You need to be sensitive towards the victims. I cannot be very blunt and brute towards the victim, which will block the information coming from the patient. So active listening is another aspect. So it will help me to identify relevant details. If patient is telling me and I abruptly ask something else, then patient will not be telling me details. And also non-verbal cues, I'm supposed to catch them up. That will help me to collect further details. And communication skills, I don't need to talk about it further, because we all know how communication skills, if they are good, will help you to collect details from the patient. And also when I'm talking to the patient, I have to be respectful about his cultural beliefs. I might be dealing with a Muslim patient, I might be dealing with a Sikh person or a Hindu person. I need to be very much respectful towards their culture. I cannot say that this religion does like that. No, I cannot say that. I have to be very respectful towards their beliefs, their practices, their customs, even their any cultural aspect. And emotional resilience. Emotional resilience means I might be encountering one day a rape case, another day I'm looking for a domestic violence, third day I'm looking for sexual abuse of elderly, I'm looking for abuse of pregnant women. So these causes emotional trauma to a person. And some at the at some point of life, you get stressed out. So in that case, as a forensic nurse, I have to have resilience. I should be able to cover up or come out of those traumatic or challenging situations. And professional ethics, I need to hold the high standards of it. These were the skills which are required by forensic nurse when she is collaborating with the emergency nurse. Now, what are the roles and responsibilities when I'm dealing with emergency cases? Now, major role is medical legal examination, but for that you have to have a specialized consent. Normal consent, what patient gives is just a general care. But for when I label that case as a medical legal case, or when I label it as a forensic case, then I have to have a special consent to be taken, and patient can deny it. If patient denies it, then you cannot do anything. But then you have to convince the relatives or the patient, then only you can proceed. So in that case, medical legal examination is another responsibility of forensic nurse, so that nothing is missed out. And collection of all the samples and chain of custody, I've already told you, and informed consent as well. And a thorough examination, not only the patient's body, but even clothes, the cuts. Many a times a wound will also give you the details. Wounds, like if patient has been exposed to some dirt, or must have seen in the movies that if it is a sand, it must be somewhere near to a tropical area. If it is something muddy, then it is something near to a rainy area. So that way it will give you details. So you have to do it in a very ethically. It should not be, intruding into the person's privacy, and should not cause any additional stress to the victim. So keeping the safety of mind and body, you have to work with the protocols. Now, why emergency nurses need to know about forensic nursing? Because if there is a delay in collection of the evidences, collection of the any kind of traces, then it is a delay on the part of a forensic nurse as well as the emergency nurse. And we are liable to get penalized. We can be fined for that delay or for that negligence. So, because it will hamper the investigation. Now, let's say if there is a domestic violence case has come and there are different DNA traces on the patient's clothes, and you have just thrown the clothes, then it is a delay and negligence and it will hamper the investigation. So judge can penalize the nurses even. And what kind of punishment can be? It can be up to 7 years of rigorous imprisonment for the person who has done the negligence. So you have to be very careful and you have to be very responsible. As I mentioned, if an emergency nurse finds that there is something foul play or there is something fishy in it, then I can label that case as a medico-legal case. As I mentioned, के patient ने बोला कि it has come just by chance the gun has come up, इससे मेरी injury हुई. But you think that it has been done by someone else. So you can, without any consent of patient, you can label it as a medico-legal case. Now, how do I label it as medico-legal case? I will inform the police. Every hospital has a police chowki in it. So I have to call the medical officer, and medical officer is supposed to make it as a medico-legal case, inform the police chowki and get the help from there. And then only the proceedings will be started. We will not delay the treatment of the patient, but we will start working in that angle. And consent again will have to be taken. And as I said, you cannot perform any examination if consent is refused. Documentation is also important because medico-legal duties will be like, it is not necessary that I will be there all the time as a forensic nurse. So whatever I've documented will be supported with different diagrams or components. So with that, I will have to write my clear report. And I will give you an example. Unnecessary exposure should not be done. So if I have the facility of the photograph, I can do this photography. If I do not have the photography available, then what I can do is I can go for a diagram. If you see this side, left side patient has no marks, but if I look at the right side, you have marks. So in this case, very clearly, we'll have to write what all observations you have done. Now, what I was referring about the UV photographs. Now, this is a case of a child abuse by the mother itself. Now, what mother did is mother held the baby with the body. If you see these two marks, these are held by the mother. And then she shook the child and it just threw the child. And that left the mark or bruises on the image. With our naked eye, we were not able to see this, but with the UV photographs or UV lamp photography, we were able to look for these evidences. So such kind of documentation and supporting documents are required to be done by forensic nurse. And referring to taking a photography, it should be marked well. When I'm talking about the marked well, if you see, this is the calibration done on the patient's body side. So this way, it is clearly showing what kind of marks, how big it is, what kind of injury it is. So description of the photographs will itself show what all things we are referring to it. Earlier also, I've mentioned about the abbreviations. We do not inculcate the abbreviations unless and until it is very much necessary, because you all know that court proceedings go for years. एक साल, 2-3 साल एक case चलता है. So in that case, what I have written today, I might not remember after 3 years. So in that case, abbreviation should be avoided. So it is very much important that you write what is legibly you are able to read. There is legibly good handwriting. So if you have to refer it after 2-3 years also, you are able to recall what you were doing. Now, technical terms, again, we do not write technical terms, should be as minimal as possible. Because as a medical person, I know what all technical terms are there. But who all will be referring your documents? advocate will be using it, police people will be using it, insurance agencies will be using it. So in that case, if you're using technical terms, they will not get the gist of what you're trying to say. So we will try to avoid technical terms or jargon. And handing over of the evidences, I've already mentioned. Whenever I'm doing it, I will do it in a very particular manner according to the SOPs. SOP is standard operating procedures, protocols. So according to the protocol only, I will hand over. I will take the receipt of the patient, and I will take the receipt of the person who is taking the evidence from me, and all details. In Indian setup, we take a Aadhaar card copy, or we take a identity card copy whenever I'm handing over any kind of evidences. Small initials will not work. Full name with complete signatures, it is required. This is what I've just spoken about. Now coming to the challenges that we are facing. Forensic nurse, we have been talking about since last 1 year only. And it is very, not very clear thing. Abhi tak, if you ask me, it is only the registered medical officer who is going to the court, who is dealing with everything. The work is done by the forensic nurse. Till now, if you ask my previous experiences, everything is done by the registered nurse, because we don't have forensic nurses, but registered nurses only are doing everything. But the credit is taken by the registered medical officer, who is going to the court, who is taking care of all the writing part. So we need to have a clear and unambiguous or non-overlapping job description for the forensic nurse. And for that, I hope INC and NNMC will collaborate together, and they will come up with some specific model, because till now we don't have any specific model based on which the forensic nurses would work. And when we are talking about the protocols, then law also will be required to be modified, where it will be specified what is to be done by a forensic nurse, what is to be done by a forensic doctor. And other than that, I think protocols need to be outlined. And as with the period, I feel we will have a more elaborated and more known aspect of forensic nursing in future. And forensic nurses can definitely give a holistic care, and care which can be missed out with by common registered nurses. And coming to the end of my talk, that forensic nurse, as I said, it has come to light only since 1980s. And with progression of time, soon we will have forensic nurses in India also. And we look forward from the younger generation who is attending this session, that you will also come up with your specialty as a forensic nurse. Thank you so much. If you have any doubt, we can take up. And if you wish to contact me, here are the details. And I again thank you everyone for listening me patiently. And if you have anything, we can discuss and take up whatever you wish to talk about. Over to you, Bhavna ma'am.
Thank you, ma'am. Thank you so much, ma'am, for your valuable information on emergency trauma nursing. It will definitely help us in future. Thank you, ma'am.
Thank you so much.
Now moving ahead into next session, which is on patient care facility. For that, I would like to call Dr. S. Lakshmi Prabha, ma'am, Professor, HOD, Department of MSN at Vinayaka Mission, Annapurna College of Nursing, Salem, Tamil Nadu. Ma'am has done PhD in nursing and has more than 24 years of experience in field of nursing. She was resource person, organizer, and paper presenter in various conference, seminar, webinars, and workshops, and published more than 20 papers and articles in National Journal and Index Journal. Also peer reviewer in Web of Science and Index Journal. Ma'am has received Best Woman Researcher by Indian Institute of Space Science and Technology and Kalvi Sevagar Viruddu by Kurinchi Kabilar Tamil Sangam. Over to you, ma'am.
Thank you so much. Can you hear me?
Yes, ma'am. We can hear you.
Shall I share my screen?
Yes, ma'am. You can send. Yes, sir.
Madam has joined. Lakshmi Prabha Madam is there. Acha is there. Actually, there was before that, there was one question I was seeing whether we need to take that. Acha, already Jyoti Madam has responded in chat, I think.
Yes, sir.
Yes, sir.
One
Actually, I
question
didn't
was-
want to disturb the session going on, so I replied in the chat box. Sorry,
Yes,
Dr.
yes.
Prabha.
Okay. Then.
Sorry.
Okay. Thank you. Thank you. Anyway. Okay, ma'am. You can continue, ma'am. Sorry to disturb.
First of all, I like to thank Dr. Binu Jo, President, NSS, Principal of Murlidhar College of Nursing, Rajkot, Gujarat. He has given me the opportunity. Thank you, sir. His untiring efforts in Nursing Scholar Society will reach a peak, and I wish him to achieve more and more as a guiding light in NSS. Next, I wish to thank Dr. Alka Tajni, Secretary, NSS, Principal of Vibrant College of Nursing, Surat, Gujarat, for organizing this wonderful webinar. And she has given me the chance to present here. I am also part of you. Thank you so much, ma'am. Now we'll move on to the session. Ma'am, is it visible? No? Bhavna, ma'am?
Yes, ma'am, it is
Yes, ma'am.
visible.
Okay. The topic what I got is patient care facilities in accidents, trauma, inappropriate treatment, and medications. So before that, a small review about forensic nursing. Everybody might have told this. The word forensic comes from forensis. It is a Latin word, and it is nothing but debate, it means. So whatever happening is in the court that is related to the law, so it is considered as a forensic. So the forensic nursing has adopted from 1992, and it is emerging in our India also. It is mainly focusing as like wherever we are arising. Here also in the forensic field also, we have started arising. So it's the application of nursing process. Everywhere we are applying, here also it's application of nursing process to public and legal proceedings and the application of forensic healthcare in scientific investigation of trauma and death-related abuse, violence, criminal activity, liability, and accidents. So when we move on to this forensic nursing, we can very well say in the accident, trauma, and all the areas, violence, what is our main role? Why we have introduced here is we are the first line workers and we are the person who can able to talk, have a good communication skill as well as who can able to identify anything, any evidences we can catch as well as physical examination we can do better compared to all the other people. So in the first line, we are the nurses present and it is a truthful profession. So we will be the supporting person for all the other team members. So the forensic nursing plays a main role and it is emerging now. As our NSS president says, as after this INC has introduced in the 5th semester, same like that, MSc nursing also, some of the colleges have started. So it will be a very good future for us. We will be moving with that. So the forensic nurse is a registered nurse who blends the holistic care of nursing to the body, mind, and spirit with the principles of law, medicine, and science. And forensic patient is an individual who has a healthcare issue and intersects with the legal system. So when we see the accident is an undesirable or unfortunate happening that occurs unintentionally and usually result in harm, injury, damage, or loss. So it is an undesirable and unfortunate happening. And when we see through legally, it's a happening resulting in injury that is in no way the fault of an injured person for which compensation or indemnity is legally sought. So legally as well as in our medical field also, we can very well say it is undesirable and unfortunate happening, which will be resulting in damage. So due to accident as well as any other reasons, injury may occur. A physical harm or damage to someone's body caused by an accident or an attack. It's an injury. When we see legally under section 44 IPC, any harm whatever illegally caused to any person in body, mind, reputation, or property. And when we see medically, any breach or discontinuity of the tissue of the living body. So it's an injury. So the accident will be resulting in injury. So when there is an injury happening, what is a forensic nurse role that we will see in detail. So what are the types of injury? Or traumatic brain injury, spinal cord injury, back injuries, burns, internal injuries, fractures and broken bones, disfiguring facial injuries and scars, limb loss and amputation, neck injuries, knee injuries, foot and ankle injuries, shoulder injuries, wrist and hand injuries, lacerations, bruises, crash injuries, soft tissue injuries, post-traumatic stress disorders. So these are the common types of injuries. So how the injuries are happening, how we can able to categorize, or according to the location of the program, that might be the injury happening in the patient care facility, that is acute care hospital versus community clinic versus family care center. There may be, it will be resulting. And what is the cause of the injury? Or major trauma such as physical assaults, gunshot wounds, stabbing, and pedestrian struck, or from motor vehicle crashes, fall down from stairs, or work-related injuries, or the causes for the injury. So here a forensic nurse can identify accidental versus inflicted injuries, improve documentation and treatment, and provide a variety of testimony as necessary. So what is the role of forensic nurse compared to other people? Or she can able to find out whether it is intended or it may be done accidentally. That will be identified through a forensic nurse. So neglect. Neglect is nothing but it's a form of abuse where the perpetrator who is responsible for caring for someone who is unable to care for themselves and fails to do so. It can be a result of carelessness, indifference, or unwillingness and abuse. So the neglect is a form of abuse. It can be happening for children or elderly or anybody. If anybody we have to take care, we are not able to take care, and due to carelessness, the people are not able to take care, means that will be resulting in neglect. It includes inadequate health care, education, supervision, protection from hazards in the environment, and unmet basic needs such as clothing and fooding. So the neglect issues are, if any issues happening within this healthcare, education, supervision, protection from hazards in the environment, and unmet basic needs such as clothing and food, or neglect issues. Next, in the inappropriate treatment and medications, if there is a not suitable medical attention given to a sick or injured person, that is inappropriate treatment. We are not giving a suitable attention. And to how to this inappropriate treatment and method can be rectified, or mainly in 4 major steps. First one is measuring the use of medicines, how much we have to give, we supposed to give, that we have to see. And then identifying the determinants of inappropriate use, which are the determinants for the cause for the inappropriate use, that to be identified. Developing, implementing, and evaluating the impact of interventions, and working towards an enabling policy framework that encourages appropriate use. So the appropriate use policy should be developed, implemented, and evaluated, and we have to progress it. So these 4 steps when we are following, the inappropriate treatment and medications will be corrected. We can give appropriately. So how can we will overcome these issues? It is repeating, I think. All the resource persons are concentrating on these 3 aspects because it is very valuable. First one is evidence documentation. Next is collection and preservation efforts. All the 3 aspects. We have to document evidence. We have to find out the evidence as well as document the evidence. We have to collect as well as preservation effect. We have to preserve. So in these aspects, if we are correcting, we can overcome all the issues. So for the overcoming, how the forensic nurse should be is, the nurse should be knowledgeable in Indian Penal Code, the law as well as medicine. Everything should be covered by the nurse's knowledge. And mandatory reporting is a must. Then patient's legal rights to be recognized as well as collection and preservation of evidences to be done. So these knowledge, when the forensic nurse is having, she can able to get a bright future. So what are the characteristics of forensic nurse? Or the first healthcare professional, identifying, collecting and safeguarding the evidences. She can able to identify abuse and neglect and assess patients within the context of the requirement. Then to make appropriate referrals, she is a first healthcare professional. So these are the characteristics forensic nurse should have. So searching evidence, how we can search for the evidence, by Dr. Edmund Lockhart, who is the father of trace evidence. Everybody might have known Sherlock Holmes. So Sherlock Holmes is a person, how he was able to identify the evidences, how he is collecting. Same like that, this person from France have identified so many evidences, and he is a person who has given the name, every contact leaves a trace. So there will be a trace when we are searching for evidence. This principle is really inevitable in forensic investigations as it forms the base. So how we have to move? He has told victim, suspect, scene of crime. So all this is a web, and within the web, who did what and what evidence was left behind, that will be identified. So victim, suspect and scene of crime should be identified, and from these areas evidences should to be found out. So when we found out the evidence, we have to collect the evidences, and then we are supporting the victims as well as expert testimony to be identified. So testimony in the sense, we are the person sometimes to be given testimony in the court also. So whenever go through with this all these steps, the nurse should be more knowledgeable, and she has to justify what she has to present and how she has to testimony. So we can take the evidence. Evidence is defined as something that gives proof or leads to a conclusion. So which includes documents, testimony and objects. All 3 are the evidences. So how we can collect the evidences or appropriate medical history, examining patients, documenting exam findings, whether or not evidence to be gathered. So appropriate medical history to be collected, examining patients to be done, documenting exam findings, physical examination findings should be documented, whether or not evidence is to be gathered. Next, using specific concrete terms, that is crying, shaking or anything, and the statements could be admitted as evidence, and it is important to write down the exact wording of the statement. Whatever wording the people might have given, the same wording should be given in statement and it should be recorded. It can be audio tape or it can be a video recording, anything. It should be exactly to be collected, the evidence to be collected. Then examine patients promptly to minimize the loss of evidence and identify medical needs and concern. So the patient should be examined promptly, physical examination to be done thoroughly, and there should not be any loss of any evidences. So head to foot, when we are watching the patient, all the techniques we have to use, inspection, palpation, percussion, auscultation, and any injury is there, it might be due to what is cause, and how far it is affected in the skin, everything to be taken, photographs and videos, everything to be collected without, there should not be any loss of evidence. So all the details should be collected. Not every situation is same. So all the situations will be different. So we should not miss any evidences. Not all the victims are able to move under their own power. Each department may have its own policies and procedures to follow. Once the report to the police has been made and the alleged victim arrives, the forensic nurse should begin the examination. It starts with obtaining concerns, biographical intake information, a medical history, and finally a history of events leading up to and surrounding the crime. So in this, we should not miss any evidence. For that, the situation also will be different. So we should be concentrating as like a new situation. We have to go and we have to found out the evidence. And victims also should not be missed. So all the victims to be collected, and we should get all the information, history as well as physical examination to be collected properly. And each department will have its own policy. So we have to follow the policy also. We have to obtain the consent in each and every procedure. In nursing also, we are going for informed consent. So here also the consent is very much valuable. Obtaining consent, then biographical intake information is very much necessary. Medical history and history of all the events surrounding the crime also to be collected. So when we are collecting the evidence, we should not miss the evidences, as well as we have to collect safely. That we will go in detail. So what about the consent form? Informed consent in each procedure, we are getting in the nursing procedure itself, we are getting the consent from the patient. Same like that here also consent we have to get. This will empower the patient, involve them in the process and give them an opportunity to think of and ask questions. So consent will empower the patients, and then consent to treat must be obtained before any evidence collection or treatment takes place. So before the evidence we are collecting a small hair or anything, any tissue we are taking also, we have to get the consent from the patient. Then consent forms may vary from one institution to another. So this also we know, everybody know. So the consent form according to the institution we have to collect, and we should keep it for the legal applications, everything we have to keep the consent forms. So the consent is for the collection of evidence, urine specimen with drug testing as needed, sometimes collection of blood for lab work is needed, use of colposcope to assist with injury identification is needed. Colposcope is nothing but there will be a lens for visualizing, a machine with lens for visualizing in the multiple images, and it will be a magnifier. So magnifier along with the lens will enlarge the size of the tissue or anything. So that will be used for injury identification. Then forensic photography, that is with colposcope and digital photography to be taken. Use of recording equipment and consent for emergency contraception. If the victim is a minor, then the parent or guardian will need to sign in his or her place. So all these things to be checked, to be collected along with the consent. So in case of victim, what are the victim details to be collected? Or we have to see, it will be varying according to the victim perspectives will be varying when we are collecting the evidences. What are they? Are age, gender or gender expression, physical health history and current status, mental health history and current status, disability, language needs, deaf and hard of hearing individuals, sensory or communication disabilities, ethnic and cultural beliefs and practices, religious and spiritual beliefs, economic status, immigration and refugee status, military status, history of previous victimization, past experience with criminal justice system, prior relationship with the suspect, if any. So all these perspectives to be taken care when we are collecting the evidences. So when they are giving the evidence or when they are cooperating or not, that will be according to these perspectives only. So next we have to move on. to the intake. So the date and time of the examination. The date and time of the examination, forensic nurse examiner and the assisted individual, the patient's name or guardian and contact details, the patient's insurance information, referral sources, suspect information if available, and brief history of sexual assault exams, then ethnic and cultural beliefs and practices, person providing the patient's history to the examiner and his or her relationship to the patient. This may go to the credibility of the information provided at some later date. So this also to be concentrated when we are collecting the evidence. So when we are collecting the forensic history, we have to go with these things. First one is date and time of the assault or trauma or injury. We have to note the date and time of the assault, the time taken between the assault, physical examination, evidence collection, documentation of the events, then pertinent patient medical history. Due to various factors like menstruation, surgeries, bleeding disorders, other treatments, interpretation may get affected. So this also to be concentrated. So we have to see for the recent consensual intercourse. So the DNA analysis will be affected for that. So we have to ask the history of the about the recent consensual intercourse. Then post-assault activity of the patients. Patients' actions and the time may affect the quality of evidence collection, and even we may not get adequate quantity. Then check with the patients, has he urinated, defecated, cleaned the genitals, used the pads, cleaned his mouth, brushed, had food, drink, smoked, changed his dress, etc. Everything to be collected. So for the assault or trauma, anything is there means we have to ask all these things. If it is not done, some tissues or whatever evidence is to be collected, that should be collected and kept in a cover. Then we have to see the site and location of injury, pain status, and then they also should check for any strangulation, that is airway obstruction or anything is there in case of sexual assault cases. Then suspect information, if known, that is in case of any suspiciousness is there, for that also we have to collect the evidences to find out the strength of the evidence is useful for this case or not. So forensic scientists may seek evidentiary items, cross-contact or transfer among patients, suspects, and crime scenes. If gender or number of suspects are known, foreign materials that might be used on patients' bodies, that might be found on patients' bodies and clothing, and detailed suspect information should be gathered during the investigative interview. So then we have to see the physical surroundings of the assault, indoor, outdoor, car, room, rug, dirt, mud, grass, or anything, everything to be checked. Then tactics may include, but are not limited to use of weapons or there or not, that is to be checked. And then knowing whether suspects may have been injured during the assault may be useful when recovering evidence from the patients. Then detection of alcohol or drug facilitated sexual assault is there or not, that is to be checked. So collecting information about vomiting, loss of memory or consciousness, then intake of alcohol, drug, everything forcefully or self they have took, that also while collecting the history and while seeing the physical examination we can very well identify. Then collecting toxicology samples within 120 hours of the suspected ingestion is recommended by the jurisdictional policy. So toxicology samples also immediately collected. So these are the things we have to collect. And then we have to move on to the next step. We have seen how to be collected the evidences and how we will be gathering it. That also we'll be seeing now. When properly recognized, documented, and preserved, can provide a crucial link between the person and location or object that caused an injury. So when we see the forensic nurse's role. The forensic nurse is a gap between law enforcement and the physician and other healthcare professional. She's a bridge of all these people, and the forensic nurses may be called upon to testify a criminal or civil courtroom because their interaction with victims. So in the courtroom also they will be called upon and to give a testimony. They are readily acceptable as a credible expert witness because their specialized training. So they will be an expert witness because of their special training. So what is a primary survey? We have to go with this, or taking care of patients immediately. When there is a medical or psychosocial need is there, immediately the patient should be taken care. Next, ABCDE is a priority of care and preservation of evidences. ABCDE, everybody know, airway we have to see in that patency, foreign bodies or obvious injuries are there or not. Then consider C-spine with patients of possible trauma or assault. Preserve unusual foreign objects. This to be done in airway. Then breathing, effectiveness of breathing, integrity of chest wall. Then any deviation is there or not, that is to be found out. Then do not cut through bullet or knife tracks in the cloths. So in the cloth, any tracks are there, we have to take a photograph or video, or any bullet or due to bullet track cloth is anything damaged, that also immediately photographs or video to be taken. We should not cut immediately. After taking the evidence, after collecting that, then only we can cut and remove the cloth or anything. Then label and retain any unusual objects or scrappings. Scrappings also can be collected, as well as any unusual objects are present, that also to be labeled and collected. Then circulation or perfusion. In the circulation, pulse rate and quality, skin color, temperature, capillary refill to be checked. And in case of disability management, alteration in consciousness, shock, presence of any medications, that is to be found out, and we have to manage the disability. Then exposure to any harmful devices or harmful thing, we have to immediately remove the cloths, and before that we have to preserve for evidence, and after removing also that cloth should be taken care safely, and the injuries, anything has happened, that also to be documented immediately. So this is a mainly we have to go with the primary survey. Then physical condition which may require treatment immediately to be treated. Documentation of the physical findings like photographs, drawings, notes, everything to be documented. The lab specimen collection, preservation and documentation of the evidence to be done. Provide appropriate treatments and ensure the patient and family well-being through the health education and teaching. So all the appropriate treatment as well as ensuring also to be done by the forensic nurse. So full body image, full body photographs to be taken. That is very important. It is helpful to begin the physical examination by taking full body photographs of the patient. Front, back and sides and documented in the patient's chart and file. It also provides for negative documentation, that is recording of areas of the body where there is no evidence of defect, disease, injury or potential transfer. Anything is there also, it will be, the photograph will be very much useful. Items to be immediately checked. Height, weight, body mass index, physiologically stable or not, that is to be checked. The mental status, we have to see the person is conscious or alert, cooperative or uncooperative, lethargic, refusing to do the examination, and the reason for the same. So these informations to be collected immediately by finding out the person is mentally affected or not. The mental status will be judging a person. After the incident also the mental status will be affected, or it might be affected before. That is to be identified by the forensic nurse. So we have to go with the head to toe physical assessment, patient's general appearance, system-wise examination within the normal limits or specify otherwise. Then focus on identifying any injuries, including bruises, abrasions, lacerations, patterned injuries, burns, or any signs of skeletal injury or head injury. All these things to be examined for collecting the evidence. So in the physical examination, what are things we have to do? What are things we should not do? Or first do is place a clean sheet covering with the second clean sheet to be made for the person. Then fold and package this top sheet separately. If clothing must be cut off, it is done without cutting through any tears, holes, or any other defects in the fabric. Use a protective paper to prevent stains from touching. Include footwear in the collection of clothing. So in the collection of clothing, footwear also to be added. So all the evidences to be safely collected. For that, we are doing all these things. And don'ts are no excessive handling. We should not handle excessively. Separate paper bag to prevent cross-contamination. Do not remove attached hairs or fibers from the clothings. If cloth is wet, it is allowed to air dry before packaging. And plastic bags are not used because moisture can collect within the bag and alter the evidence. So paper bags will be used mostly. So this handling, when we are handling the patient, we should be taken care. So in case of blood sample, blood evidence must never be exposed to excessive heat or humidity and should be refrigerated until it can be transported to the lab. So it should not be exposed to excessive heat or humidity. So how it should be collected, blood evidences are, when it is a dried evidence, cutting out of a portion of the item with the blood stain, tap lifting blood stains, scraping blood stains into the paper packet. So these things when it is dry. When it is wet, if the item is small or transportable, then package it in a paper bag. If it is large or not easily transported, then observe the stain onto 1 into 1 inch square of the cotton muslin or package it in a paper bag. So these things we have to do when we are collecting the blood evidence. So for the foreign materials, we have to inspect the body for the head, hair and scalp for dry or moist secretions and statins. Example, blood, seminal fluid, sweat or saliva or any other foreign material present in the head or hair or scalp, that is also to be checked. And then collect the swabs from any suspicious area, especially high yield areas, neck, breast or external genitalia, also swabs to be collected. Use a moist swab to collect dry secretions followed by a dry swab. Swab moist secretions with the dry swab. So 2 swabs also to be collected, moist as well as dry swabs. Separate swabs should be used for every sample area collected. Follow jurisdictional policies regarding the number of swabs required to collect each specimen. So we have to follow the jurisdictional policy also. So we have to go with the bite marks. Any bite marks are present or not, that is any assault or injury, bite marks also can be there. That is also to be taken a photograph as well as it should be checked completely. Then in case anything is necessary, smear swabs also taken for onto the microscopic slides. So that will be also, it is optional, that can be taken. Then cut matted head, facial or pubic hairs also to be collected. According to the jurisdictional policy, air dry all specimens, package swabs and slide separately, label, seal and initial the seals. So after collecting all these things, we have to package the swabs and slide separately. And we have to label and seal. Then note that coding of evidence must allow the crime lab to know which swab was used to prepare which slide. So we have to seal and initial the seal, that is very, very important. So in case of oral swab collection also, we have to see the teeth is flossed, that is also to be checked, and then we can label and seal. So how to collect the hair and fiber evidence? That is, place sharp objects in double peel packs. We can use this sharp objects. So that will be very easily, will collect the hair or anything, small fibers or hairs will be collected through this. Then wrap bullets in gauze to preserve trace evidence and place in a peel pack, pack, cup and envelope. So when there is a bullet is there, that also to be packed. Do not touch the bullets with metal instruments. Gunpowder residue can be removed with the tape. So any residue is there, that is also collected. Last slide. Preserve evidence on the victim's hands until collected by securing paper bags over each hand. Scrap or swab beneath fingernails and clip fingernails and package and label. Then carefully comb the hair to remove evidence that may not be visible. So when there is not visible evidence also, we have to comb the hair and we have to check for any evidences present or not. Next, how to collect from the any orifices. Patient consent we have to get first, and then specimen should be collected from the orifices like oral, vaginal, and anal, and then surrounding areas also to be collected. If there is assault, there will be we can collect the evidences specimen from those areas. Ask appropriate questions and confirm the same before collecting the specimen. So when we are collecting the swabs and smears, caution, that is patient who use a bathroom prior to the exam. Priorly he has used or not. When there is evidence is present, means that is to be, that should not be washed or wiped away for any secretions. When they are using the bathroom or anything also, they should not be, he or she should not wash or wipe the genital areas. So the secretion should not be, that is the evidence won't be collected properly. So we have to see for all these things. And then whenever we are collecting the swabs or collecting the smears, glass slides, when smears when we are collecting or any samples we are collecting, we have to see the jurisdictional policy also. Do not stain or chemically fix swabs and smear. When preparing the slide, note that coding of evidence material must allow the crime lab. So we have to label it properly. So which slide is what? That is to be labeled and sealed properly. We have to document any foreign substance or material introduced by the healthcare providers. That is when we are using any anything also, that is also to be document. We are using a betadine or any lubricating jelly also to be documented. So how to collect the body fluids? Use a high intensity lamp to visualize stain or biological secretions. Collect dried secretions or fluids with a slightly moist and sterile swab. Then swab bite marks. After photographing, we have to swab. Then in sexual assault cases, swab body orifices for biological specimens, collecting as much as possible. Then collect laboratory specimens for toxicology screens and control. In case in DNA analysis or anything to be done means, for that also the specimens to be screened properly and set. It's documentation. The entire physical examination to be documented, audio taped and transcribed for investigative, reconstructive, and court purposes. After all, this is a forensic procedure. After all, this is a forensic procedure, and the resulting findings are intended to be used as evidence. Additionally, it will protect the forensic examiner that the patient claim, if sometimes the patient may claim for any mistreatment, and the patient may feel he has affected like that. So that is to be to save the forensic examiner also, we will have this audio tapes and also video recordings. With respect to photographs, take more or less. Take more, not less. So excess of photographs to be taken. But be sensitive and professional. If a photo not taken, the entire case may be misinterpreted. So the photograph we have to take for each and every evidence when we are collecting, we have to take a photograph. We should not left out anything. That is documentation. So these are the things we have seen in case of patient care facilities, how to collect the evidences, how to save the evidences, how we have to document, that is major important in case of any accidents, trauma or anything. And in case of inappropriate treatment, how we have to collect the data, that is very important. Those things we have seen in detail about this in this content. Now we move on to one more content.
अभी दो अभी दो और खाएगी
Sorry for the interruption. Next, we move on to
Ma'am,
police
खत्म
correction.
क्या रहा?
Sorry. Shall we continue?
Yes, ma'am.
Okay, ma'am. Next, we move on to police corrections custody abuse. Sir Joseph Biden, Vice President, have told forensic nurses play an integral role in bridging the gap between law and medicine. They should be in each and every emergency room, like that he has told. And these various field, last class you have seen already. So once again, I'm repeating. So under the forensic nursing, now forensic nurse itself new to us. But in that, so many roles have came, so many branches have came, and many people are shining in the branches also. So you can see many types: forensic nurse, educator, consultant, then sexual assault nurse, examiner forensic nurse, death investigator nurse, coroner legal nurse, consultants and nurse attorney, clinical forensic nurse, examiner forensic psychiatric nurse, and correctional nurses. So many nursing roles, various fields have came. So these roles have there are many in abroad, many nurses are shining in these roles, and I will show some evidences also. So first, in case of forensic gerontological specialist is, do you know gerontology is geriatrics? So in the geriatrics, those many people are affected, that is abuse, mostly old age abuse is there. So for those people, those who are present in old age home or in a hospital or anywhere in their home itself, so when they are affected, for them, forensic gerontology specialist is there. So that person will investigate the cases and surrounding, what are the cases surrounding the elderly people, that will be investigated, and they will be working in the nursing homes and hospitals, these nurses. And then forensic psychiatric nurses treat and manage the victims and offenders with serious mental disorder. When there is a mental disorder is serious, and also mentally the people are affected, that is suicidal tendency or any depression or anything, the people are affected. So the forensic psychiatric nurses will play a role here. Then sexual assault nurse examiner is nothing but same. We used to say same. This is more emerging in the abroad countries. So these people will admit care and forensic examinations to victims of sexual assault trauma. So they will be mainly taking a role in case of sexual assault for all the people. They are the persons, forensic nurses working in this field. And then forensic nurse investigators are working with law enforcement and to determine the causes of unexplained, that is unexpected, immediate, that is like accidents or violent deaths. Immediately with the law enforcement, the forensic nurse investigators will work. And then nurse coroners are nothing but they are the death investigators. They will be working with the coronal officers, government employees. They will be working, and the nurses will be along with the employers. They will be also investigators, investigating the things. That is nurse coroners. Then clinical forensic nurse examiners. These clinical forensic nurse examiners will be present in emergency and critical care also. So emergency and critical care nursing, those who finish, they can be doing these diploma courses and they can be shining in this field. They deliver a care to both living and deceased, identify forensic cases, provide accurate documentation. So these people can do this work. Then legal nurse consultants, they are like nurse lawyers, assist attorneys with cases need medical expertise such as medical malpractice or personal injury lawsuits. So they are like a nurse lawyers, legal nurse consultants. And then correctional nurse specialist. Correctional nurse specialist is nothing but in case of correction, that is in the prison, along with the police, that we will see in detail. They will be giving a routine and specialized care to the people, those who are in jail, prison, and any specialized settings and correctional homes like juvenile homes. For them, they will give a special care, that is correctional nurses or prison nurses. Then clinical forensic nurse examiner. This clinical forensic nurse examiner is nothing but they are the person, they will be encouraging the people in case of organ donation or tissue donation, and they will be supporting the transplantation process. So when there is issues, legal and ethical issues related to organ donation process, this clinical forensic nurse examiner will be supporting. Then forensic psychiatric, I told already, the person will be connecting a gap between the criminal justice, legal and mental health problems. So these people will be helping in this. So various roles are present in within the forensic nursing itself. So when we move on to the topic, police corrections, custody abuse. Custody is nothing but it's a protective care. According to law, custody means person in imprisonment or judicial or penal safekeeping. So in the custody, we have to keep safely. Under the police custody, people are present means they have to keep the person safely. But in the custody itself, there is abuse when the police officers are not abiding the rules. So what will happen? It will be abuse. Police officers should abide by the principles of law and should not violate it. When there is a violation, it will be a custody abuse. Abuse is a kind of any violence, torture, hurt, or use of force in order to inflict or cause injury or damage to the people or anything to any material, car or motor vehicles, anything. So that is also abuse. So correction, in case of correction, custody abuses, when we are not utilizing or not safeguarding the public as well as the any instrument, any machines, it will be a abuse. So why in the police field forensic nurses are present? Or forensic nursing, we have seen so many in the about the forensic nursing we have seen. In the police field, there is a high demand for forensic nurses because law enforcement community is increasingly recognized there should be some expert needed. That is, a forensic nurse should be needed in the police field also. Their role is invaluable to the criminal justice system because they provide a link between the medicine and law. This we have seen already, and they will be getting a special training in case of evidence collection. We have seen no evidence collection, preservation, wound identification, law enforcement investigation, documentation, chain of custody. All these things, they are expert. They have a specialized knowledge and specialized training. So these people are needed in the police field also. All the forensic nurses must be RN, that is registered nurse, and along with that, they have to complete a forensic nursing specialty. So these forensic nurses related to the care, treatment, and management of those persons who come into contact with the criminal justice system. This include high security, medium security, low security hospitals and community setting. Anywhere the forensic nurse in the police field will work. High security system as well as medium security as well as low security hospitals and community setting also. These includes police station, court and prison also. So all the areas the forensic nurses will work. So these forensic nurses will be considered as named as correctional nurse or prison nurse. So it is nursing as it relates to the prisoners. So it is a prison nurse. Nurses are required in prisons, jails and detention centers. They are providing physical and mental health to the detainees and inmates. In these correction settings, nurses are the primary healthcare providers. So in the jail or in the police station, what the nurses will work, or we will see in detail, these nurses will work with the crime victims and assist in expert witness testimonies and are involved in the variety of legal cases, including paternity disputes and workplace injuries. So many conditions the nurses will work with the police. So what are the services provided? Or examination of victims of abuse, sexual assault, violence, trauma or death. Examination, physical examination will be done by nurse. Then documentation of injuries and findings, both in the written record and photographically. The documentation will be done by the nurse. Then recognition, collection and preservation of physical evidence, either from the victim or victim's clothing or from the scene of the crime, accident or injury. So all these areas, the forensic nurse will recognize, collect and preserve the evidences. Then examination of suspects for injuries as well as collection of trace evidences will be done by the correctional nurse. Then collecting of legal blood and urine specimens for alcohol and drug testing. We have to collect both. And then providing physical and emotional comfort to the victims and their family members. That will be done by the correctional nurse. Then examining medical records for any clues, everything to be collected, documented by the nurse, and she is again examining the medical records for any clues will be found out for any crime activity or any death. Then assessment of infants, children, teenager, adults and the elderly, mentally ill as well as mentally well people. For everybody, assessment will be done by the correctional nurse. So what are skills needed for this correctional nurse? These are the activities we have seen. Services of the correctional nurse we have seen. So what are the skill she should have? Or strong assessment and treatment planning skills should be there. Then ability to function independently and respond to emergencies. Wide range of medical knowledge. Detailed documentation. Basic life support certification. Mental health experience. Wound care. Phlebotomy. Then triad skills, phlebotomy and triad skills to be there. Then health promotion and disease prevention, strong situational awareness, compassion, communication skills and resilience. These are the skills needed for the correctional nurse. So what are the skills needed we have seen? So with the skills, where and all the person will apply these skills are in case of any substance abuse or injuries or chronic medical health conditions or any mental health problems. So this will be, these issues will be rectified by her skills and knowledge. So in this, what are the responsibilities of a nurse? Or during the evidence collecting process, record patient history, take detailed photographs, describe injuries, collect evidence, and ensure the chain of custody. So these things the nurse will take care. Then dressing wounds will be dressing will be done by the nurse, administering medications, collecting other evidences, any other evidences present that will be collected, testifying in court, career traits, trauma-informed care, patient advocacy, active listening, legal knowledge, and educating the patients and families on the physical healing process. All these are the responsibilities of a correctional nurse or a prison nurse. Why the correctional nurses need communication skills? So the correctional nurses, not only correctional nurses, all the nurses need communication skills for interviewing the persons. Here the victims to be interviewed with the therapeutic communication skills like active listening, validating the feelings, empathetic observations, and hopeful communication. So these are the therapeutic communication roles. So therapeutic communication is very much necessary when we are interviewing the victims. Then we have to provide the information. For providing information also, the correctional nurses need communication skills. And then documenting and relaying information. That is, when we are documenting, when the nurse knows how to communicate with the people, means the communication skill is effective, means she can able to collect more informations from the patient or from the affected people, affected victim. So from them, when the details, evidences are collected, she can able to gather and which are the necessary evidences that will be safely recorded. And by having a good rapport with the person, with the patient, she will develop a good communication and she can collect more informations. Documenting and relaying information. Delivering expert medical testimony. She can able to deliver the expert medical testimony in the court also. By collecting, by this communication skill, everything will be possible. Diffusing 10 situations. So 10 situations also will be crossed by her. Collaborating with community partners. So in the community partners, whomever work with the correctional nurse, with everybody, she can able to collaborate and work. So all these things she can do by having a good communication skill. So in the correctional nurses, they have to do mainly 4 works. That is reception screening, chronic care clinicians, medication administration, and ambulatory care in the prison. So first one is reception screening or intake screening. So intake screening is nothing but the nurse has to evaluate the inmate. So what are the things she can able to collect? We have to screen which are the informations to be collected, which are the informations to be observed. Everything will be collected by the nurse when there is a detailed medical history and physical examination is done. So that is intake screening. Then chronic care clinicians. So in case of chronic illnesses in the prison, many patients will be having chronic illness. So that is to be identified by the nurse and observed by the nurse, and she has to treat the persons. Inmates with chronic health concerns, that is asthma, diabetes, high blood pressure. So these people should be going to the hospital regularly along with the nurse, and she has to make appointments in the chronic care clinics. And then she has to support the patient, the person, those who are in prison, as well as the physician for the regular medical checkup. Then medication administration. Here in the medication administration also, so over the counter ones, sometimes there will be inappropriate medications also, medication use also will be there. So that should be identified, and the nurse should see, we have seen already, that is high security places, minimum security places. So wherever she is there, she has to restrict which are the medications the patient can take and which are the medications he should not take, and it will be observed, monitored. The nursing sick call. So when there is any emergency, there is a sick call slip. Immediately, the nurses should meet the patient. So when there is a standard protocols for conditions like headache, cutlets, foot, constipation, it can be treated immediately by the nurse. When it is a serious condition, the nurse can assess the condition and the nurse can refer the patient to the physician. So these are the measures we have to go through when we are noting with the prison nurses activities. So what are the challenges the prison nurses face, or treating all the patients are very difficult. So in the prison, so many patients will be there, so many people will be there. So according to their communication, they have to convince the people and they have to collect the informations as well as they have to assess the people. Then prisons rely on security over healthcare. So sometimes when we are giving care, sometimes due to budget limitations or patient restriction also, care cannot be given to the to the patients present in the prison. So that will be, she has to manage that also. In case of any budget limitation or patient restriction also, whatever she can able to do, those care can be given. Then many inmates with correctional justice facilities have lost their rights. So many people won't have rights to go to hospital or can't able to take any further treatment. So only the minor treatments as well as what are the things to maintain their health status, the basic health status only maintained through the this nurses, prison nurses. So another main problem is nursing mental illness in correctional facilities. So mental illness will be common among the people. So she has to handle with the patients. So nurses training in criminal justice system also to be prepared well to deal with all these problems in their daily practice. So in the prison, so many patients will be there and so many complications will be there. If they are untreated, there will be resulting in complications will be resulting in chronic conditions. Many disease conditions will be identified after they are in prison. So after identification also, getting treatment is very difficult. So according to the jurisdiction policy, the nurse can give care. Some of the most common health concerns for those in prison include communicable diseases. So sometimes communicable disease will be spreading fast in prison also. So the nurse handling will be a challenge. In older adult prison population, that also will be more. So common health problems, chronic problems like diabetes, hypertension, arthritis, cancer, respiratory disorder like asthma, emphysema, all should be treated as per the jurisdictional policy. So in case of women, some little difference is there. All the challenges what we have seen will be applicable for women also. Some more points are there as a challenge. So overall health of the woman maintenance is very poor in prison. And common chronic conditions listed above, along with that, reproductive health services also to be provided for women when they are in prison. So repeated gynecological examinations along with physical examination to be done. And the mental health process of the woman also to be improved. And many reports says that compared to men, women are doing self-harm and suicide more in the prison. So in the prison, women to be watched securely, as well as the prison nurse will have a challenge to taking care of the woman. So when we see the day in life of a correctional nurse, so correctional nurse is the first healthcare professional in the prison. And when we see the national prison and jail population, it covers around 2 million patients, many national prison and all. So correction nurses is high and expected to grow. When patients are brought to the jail or prison, correctional nurse should do first initial medical examination when they are entering. And after entering also, she has to take care. When entering, there may be a chance of high blood pressure or mental illness or any infectious disease that to be treated. So nurses are the critical factor in the continuum of care for people who are incarcerated. Prison nurse distribute medications and are the first to assess people who may need further health care, including ER care. So emergency care as well as all the care, the nurses are the first person to give care. So this person, she is Kelly Langford. She is actually she is a prison nurse. What she has given in her study is she has worked as a staff nurse, and then under medical surgical nursing specialty she worked for 10 years. She got frustrated, burnout, and she can't able to continue. She want to leave her work. So that is she felt like, so what she want to do is she can't able to change her specialty or change her career. She want to be in a nursing field, but something to be different she wants to go. So what she felt is, by seeing an ad in the newspaper, the correctional facility nurse vacancy is there, and she has applied and she has selected, and she has gone as a correctional nurse. So after going, she has got a tremendous change. She got a very good salary. Salary is a secondary one, but in the working, she had more job satisfaction. She felt so relaxed. She made the difference in many people while working as a circulatory nurse. So correctional nurse. She made a difference in many persons, and she has told, when she is working in a hospital, but comparing with the hospital, in the jail there is very gray cement walls and also windowless rooms, and so many difficulties she crossed. But it is a challenge, and she worked well, and she felt more satisfaction as a correctional nurse, prison nurse. She felt that is her biography she has given, and she is paying around $58,000, it seems. She told immediately when she has entered, she got like that. She told. This is one more correctional nurse. So what this person is telling, I found the greatest reward in working, the reward of working in corrections was the feeling of making a difference for some patients. She is Lynn Kusel, correctional nurse. So that's about correctional nurse. So we can just we'll see a future of nursing. This is forensic nursing. In our India, everybody know 5th semester, we have a forensic nursing. The National Forensic Science University, Gujarat, and Icon College of Nursing, Rajiv Gandhi University of Health Sciences, Bengaluru, have MSc nursing program in forensic nursing, it seems. Now only it is emerging. As per my knowledge, just I have found out this thing. Then Manipal Academy of Higher Education and Vellore Institute of Technology also offering MSc programs with specializations in area of forensic science and nursing. Regarding salary, the pay scale for forensic nurses in India can vary depending on the factors such as experience, qualification, location, and employing organization. The salaries for forensic nurses in India typically ranges from around 2.5 to 6 lakhs per year for entry-level positions. Then afterwards, it will be increasing, it seems. And the postings also emerging so much. So this is the future. So you become a forensic nurse, save lives and solve crimes. Thank you all. Any doubts?
Thank you so much, ma'am, for sharing your expertise and making the webinar an enriched experience.
Thank you, ma'am.
Before we conclude, we have some time for your question. I encourage all the participants to share any thoughts or query you may have regarding today's session, any related subject. Our subject expert will be definitely guide you through your queries.
There is no any question, Bhavna madam. You can proceed.
One query from the participant. Uh, can nurse take part in legal proceedings as forensic nurse?
Legal proceeding, ma'am.
Yes, ma'am.
Now in India, now only we have started forensic nursing, it seems. It has started in 1992 to 95 in abroad. But here we have started only, and it will take time, I think. Anyway, we will be doing our level best. Surely we will be taking part in this also.
No, I think the person was asking, like, can the nurse be a witness
Yes, yes, yes.
in the court?
Yes, sure, ma'am. Sure, ma'am. That is our role. She's giving expert testimony. The nurse is a specialist trained, so expert testimony will be given by a nurse compared to other people. So she can be a witness.
Thank you, ma'am. Thank you so much. It's
Thank you,
essential to set the right tone and express the gratitude sincerely. Expressing gratitude, it is beautiful way to connect with others and acknowledge their kindness. I invite Mrs. Deepika Tang, ma'am, Associate Professor at Vibrant Nursing College, for vote of thanks.
A warm good afternoon. Am I audible?
Yes, ma'am, you are audible.
Thank you. A very warm good afternoon to all respected distinguished expert speakers and delegates attending this webinar across various states. I hope this message finds you well and inspired after this enlightening webinar on forensic nursing. On behalf of Vibrant Nursing College, managed by Sri Swaminarayan Education Trust and National Nursing Scholars Society, I extend a sincere thanks to each one of you for joining us for the 2 days webinar on forensic nursing. Firstly, a heartfelt thank you to our esteemed speaker, Dr. Binu Matthew ma'am, for the deep insights madam has shared yesterday. This have not only educated us, but also sparked an important discussions on the intersection of healthcare and legal matters. I would also like to extend our gratitude to Madam Dr. A. Maria Treese for such an envisioning session. Thank you so much, ma'am, for your graciousness by accepting our invitation and obliging us. Let me take this opportunity to extend our heartfelt thanks to Dr. Jyoti Katwal ma'am for such an enlightening and engaging session. Thank you so much, ma'am, from the bottom of our hearts. A bunch of gratitude to Dr. Lakshmi Prabha ma'am for walking us through such an eye-opening session. Thank you, ma'am, for sparing your valuable time and enriching young minds. I would also like to express my gratitude to Dr. Swaresh Khanna ma'am, patron of NSS, for her untiring support and guidance. A big bundle of gratitude to Dr. Binu Joy sir, President NSS, and all the administrative body of NSS for coordinating and always collaborating with us. Moreover, we are deeply grateful to Mr. Dinesh Bhai Gondelia sir, Chairperson, Mr. Kamlesh Jagani sir, Director, Mr. Parth Gondelia sir, Administrative Head at Sri Swaminarayan Education Trust for their relentless support and helping us grow always. This vote of thanks proposal would be incomplete if I do not mention Dr. Alka Tajane ma'am, Principal, Vibrant Nursing College, who always make sure that our college and students are always ahead of time. A big thank you, ma'am, for all the motivation and guidance. Special thanks to all the technical team and teaching faculties who have worked tirelessly behind the scenes to ensure the smooth logistics and seamless experience for all the attendings. I would also like to extend our gratitude to all the participants for your time and participation. Your presence and contribution have made this webinar a resounding success. We hope that today's insights will continue to resonate with you and contribute positively for your professional journey in forensic nursing. Thank you once again. We look forward to welcoming you for our future events. Good day. Jai Swaminarayan.
Thank you, ma'am. Once again, thank you to our speakers, participants, and organizers for your contribution and commitment to advancing knowledge in forensic nursing. Wishing you all continued success in your endeavors. Here's to our future interaction and continue brought together. Until next time, stay safe, stay healthy. Goodbye and Jai Swaminarayan.
Thank you, everyone.
Alka madam, can I end the meeting now?
Yes, sir. Yes, sir.